There's an old adage often directed at people recovering from addiction, the idea that they should, quote, pull themselves up by their bootstraps. However, an organization in the UP, Superior Connections, flipping that script, helping clients lift themselves up with the support of their peers. Superior Connections, a peer-based recovery community serving individuals struggling with mental illness, poverty, housing insecurity, and addiction. As we take a behind-the-scenes look at the organization, our first stop is at Upper Great Lakes Family Healthcare. Here, Superior Connections chairman and 2 other addiction specialists are serving a distinct clientele, recovering addicts they call superheroes.
I always feel like recovery is kind of a superpower, because there's probably nothing more difficult in the world for someone to do as to leave an addiction and then move ahead with their lives. And so it's very inspiring to me. These folks they're incredible.
Dr. Gross saying what attracted to him to Superior Connections was witnessing their involvement in clients' lives, one of the only groups actively in the field getting their hands dirty and literally helping lift people up to accompany them to appointments.
Well, we're the ones that go out into the community, sometimes out in the encampments where homeless folks are trying to survive. We are almost every day out in the forests and the fields or under bridges trying to get people a better place to live. And that got my attention. I thought, wow, I'd like to be a part of that.
It's called an RCO, a recovery community organization, and it's predominantly made up, organized, fueled, and run by people with shared experiences. It's the only peer-based recovery organization in the Upper Peninsula, and one of the central ideas of the organization is that addiction is a disease, and individuals in recovery need care and medical help.
The people that come through our door generally just want help. Now, whether the help they want can be in line with good for their health and good treatment is always something that you're kind of continuously navigating. But I think we see a lot more successes, and I think on our end we just really want to throw as much positivity into things as you can. I think recovery looks different for everybody. There's kind of like a saying that's if you met one person in recovery, you met one person.
Dr. Jones, another physician at Upper Great Lakes, working with individuals battling addiction, saying this group of patients is no different from any other and wanting to participate in the recovery process because he finds it immensely rewarding, filled with positivity and results.
There's not a one-size-fits-all. Otherwise every celebrity would buy it and it'd be over. But I think that you have to be unique to the patient.
So other doctors wanted to be part of this story too. Dr. Cates, an addiction specialist at Upper Great Lakes, saying the most rewarding part of his job is serving people with substance abuse disorders and his personal connection with patients and their families.
I really get to know them better than I would any other patient. So just really having that really close connection. I know all about people's jobs and their kids and what they're struggling with, and just being able to walk with them through their struggles, but then also being able to be right there when they get that job or they get into that housing. It just is really meaningful.
Cates noting that addiction is common and manifests differently in individuals with diverse paths to recovery. However, many share a common experience, a distrust of the medical system, especially since many have been let down by previous care. Cates saying one of the reasons the nation is in the midst of an opioid epidemic is due to the misguided pharmaceutical industry that initially hooked addicts.
A lot of people with substance use disorder really struggle to trust the medical profession, really struggle to trust their providers.
Now his goal is to break down the barriers to meaningful care.
I really like the fact that I can be somebody who can kind of be a bridge to build connections back to the medical establishment.
I think we just see so much different things to celebrate here. Even small wins are wins.
All 3 doctors emphasizing that recovery takes time and it's vital to believe in the potential for improvement in everyone. Dr. Gross saying that people deserve a better chance and have the capacity to heal, but they need support, whether from family, medical professionals, or society at large.
We get to see the success stories. A lot of times you hear about the difficult situations that people cannot get out of. But we see people who are back in their jobs, they're reconnecting with their family, and it's very inspiring. I mean, there are hard days, but mostly they're easy days, fun days, because people are just improving, and that's what it's all about in medicine.
The people behind Superior Connections consider themselves addicts' peers and say this distinct approach to combating addiction, poverty, mental illness, and homelessness is working.
And people have it in them to get better, but they need help. They need support from their family, from their docs, their medical staff, and society. You know, they need housing. But when it all gets put together, it's very inspiring.
Next in our three-part series on the roads to recovery in the Upper Peninsula, we'll look at the efforts in housing and social work. That's coming up this week on My UP News, and for My UP News, I'm Andrew Lawrencer.